Medicinal cannabis. It's high time that we talk about it, don't you think? And pardon the pun. In this series of videos, I'm going to be focusing on our present understanding of medicinal cannabis and what are the ways forward. And this is all going to be in context with the United Kingdom, which is where I work. So first of all, medicinal cannabis, what is exactly cannabis? Ultimately, we have realized that the plant medicinal cannabis comes from, which is two main strains that are available or species that are available in the UK and worldwide, is one of them is called Cannabis indica, the other one is called Cannabis sativa. Now these two plants have been there on every continent and they have been present and growing in every continent even before mankind and humans walked on the face of this earth. So realistically, the plant has existed long before we came on, and that has meant that as we have evolved, there has been a understanding and incorporation of this plant into our human body itself. Now you may not believe me on this front there, but what if I tell you that the most common receptor in the human body is actually a receptor for cannabis? It's called the endocannabinoid receptor. And this is part of a big system which we have only understood and learnt about it in the last 10 to 20 years, called the endocannabinoid system. So in this video, we are going to focus mostly on our present understanding and the overall role that medical cannabis might be playing as far as our health is concerned. So first, coming to the mechanisms of action of medical cannabis. As I told you, cannabis acts on a certain set of receptors in our human body, which are called the endocannabinoid receptors. There are many different kinds, but the two biggest ones that we are now aware, one of them is called the CB1 receptor and the other is the CB2 receptor. Now the CB1 receptor is present extensively throughout our nervous system and in other parts of the body, but the CB2 receptor is present on our immune system and almost every other organ system around. And that's why you can understand why the cannabis drug can have such a profound effect on so many different parts of our body. But more importantly, it also starts to make sense on why we are thinking about using cannabis for a wide variety of conditions, from chronic pain to mental health disorders to autoimmune conditions to conditions like cancer, a lot of tummy issues, conditions like epilepsy, some neurological conditions. And this is all because we understand that the cannabis receptor is much more widespread. Indeed, it is the most common receptor in the human body, and there are more CB1 or 2 receptors than your alpha or beta receptors that we generally think about in the circulatory system. So that's the mechanisms. By it acting on the nervous and immune system, it's able to bring about a wide variety of changes. It can be used for pain, it can be used for inflammation control, it can be used for immune modulation or optimizing various organ systems, and that's where it acts through these receptors. Hi, I love receiving your comments, so please keep commenting and telling me and giving me new ideas of what videos you'd like to hear and what information you'd want to know. Thanks for watching so far, and I'm hoping that you're finding this information helpful. Don't forget to hit the like button to please the YouTube gods, and please do subscribe to my channel so that you can be the first to receive information about when new videos keep dropping in. What are therefore the effects, the second part that we come to? Well, depending on how much of the strength of the individual components. Now the cannabis plant in itself has got about 70 compounds in it. It's a very complex set of molecules within the plant. The two biggest ones are of course called THC and the other one is called CBD. THC is tetrahydrocannabinol and CBD is cannabidiol. But apart from that, there are many other smaller percentages of other chemicals that are part of the plant. And apart from this, there are a variety of other small compounds called terpenes. And these are the ones that give the particular aroma or taste or sometimes the bitter smell that you have when people are smoking pot. Because when you smoke the whole plant, it's these terpenes that come along. So the effects of the drug are based on how much percentage of THC or CBD there is. If there's more THC, you get the psychoactive or the hallucinogenic or the highs of cannabis. But if there's more CBD, you have the relaxation and the more pleasant feeling that comes through. So the effect can be either of these options that you get. What are the side effects? The main side effects of cannabis are the problems that come with excessive use. So excessive use of the THC can cause hallucinogenic effects or psychoactive effects or cognitive blurring or dizziness or lightheadedness. And with CBD is usually much better tolerated. Obviously, in certain groups of people, especially in the younger, where the nervous system is developing, or in people who may have certain vulnerabilities or who have been exposed to certain changes, either genetic or environmental, to their genes, that can cause the rise of more serious problems like schizophrenia, and these have been reported in certain groups of patients. So we have to be cautious about the drug, and it's not something that's extremely safe. It has its issues. That comes to the next part, which is the challenges of long-term use. Now, you might be surprised to hear that actually the long-term use of cannabis is indeed, in the right person, there are very few long-term side effects as compared to other pain medications like opioids, or for that matter drugs that are used for mental health like the antidepressants or the gabapentinoids. Unlike those drugs, cannabis is well tolerated, is generally safe with very low incidence of long-term problems. However, the caveat still applies. In the wrong kind of patient who are psychologically vulnerable or who have already pre-existing mental health issues, that is where the long-term issues can occur of schizophrenia or some other form of deterioration in their mental health can be a challenge. So that is around the long-term issues. Next, we come on to the legal considerations. Now, the biggest thing, because of a lot of political issues over many decades, cannabis research has generally been much lower because the drug has been classified as a controlled or a Schedule 1 drug, so it was not meant to be even researched upon based on how harmful it was considered. And this was all quite complicated, and I'm not going to go into it in this video. But suffice to say that in the last 10-15 years, we've realized that when you do a good research on it, and there are many good studies that are now coming out from different parts of the world, including the United Kingdom, there is now suggestion that in many medical health conditions, especially those related to neurology, chronic pain, autoimmune conditions, cancer-related nausea and vomiting, and epilepsy, there is a good chance of it making a difference. And of course, this needs to be done with specialist approval and support. But legally, the scheduling of the drug has changed in the UK as of 2018. It's still not yet available on the NHS, but research is more happening, and there is a good chance that we will get a better understanding, more appropriate guidelines for certain conditions. At the time of this video making, there are certain forms of pediatric epilepsy and certain syndromes like Dravet's and Lennox-Gastaut where cannabis has been approved. There are some patients with multiple sclerosis related pain where cannabis has been approved, and there are certain forms of other epilepsy and chemotherapy related nausea and vomiting where cannabis has been used successfully. That might change with growing understanding and more research, but this is the present state of play right now. When we finish the legal considerations, the next thing that we go on to is the stigma. Now, consequent to the legal challenges and in some ways related to how the drug has been viewed by the medical community and society at large, there has been a lot of stigma in how the drug has been perceived. A variety of popular connotations around flower power or other such names have meant that the drug has never been used to its full potential. We're hoping that that will change now, and certainly we should be looking for that evidence, especially in the field of pain medicine, which is where I've been practicing. We know that there have been problems with pain medication. We thought opioids were awesome. We realized that they are not that good. We thought gabapentin-like drugs would be good for nerve pain. We realized that they have their own problems when used indiscriminately or at much higher dosages. They have an issue. The same is with medicinal cannabis. While it may appear safe, we need to do the learning, and we need to learn from what we have understood and the mistakes we've made with opioids or with gabapentinoids, and we need to be careful that we don't make the same mistakes with the medicinal cannabis. So we need to be able to change the perception and reduce the stigma, but this has to be a joint effort by the public at large, taking this more responsibly, by the healthcare professionals approaching it with more responsibility, and by societies and organizations introducing guidelines so that we can introduce it safely and use it for the right people at the right time with the right dosage, hopefully. Finally, we come on to cost and accessibility. At the time of making this video at the end of 2024, early 2025, in the United Kingdom, the drug is still not available to be approved via the NHS, which means that you are having to pay the cost out of your own pocket. And that can be expensive. It's still much better than what it was even 3 years ago. But this is something that we will have to do better in terms of not just the cost of how much it costs to you, but also in accessibility, because the number of players and clinics keep changing, the supply chain of these drugs keep changing, the quality of the products and the particular strains keep changing. So unless and until we have some consistency in the supply chain and the quality and the access to these products, prices will keep fluctuating. And I think only as the government legislates and we have certain guidelines can we have a more steady accessibility and a better understanding of cost. I know this video was long, but I hope you can understand that there's a lot to unpack about medicinal cannabis. There's a lot that we need to think about when thinking about it as a drug to be given. But there is hope. There is opportunity that this new drug, given responsibly, could have a benefit on many patients. And as the research comes in, we'll probably be in a better place to appreciate its use. Thank you for listening to this video, and I look forward to seeing you in the next one. Thank you for watching this video. I hope you found it of value. So don't forget to like this video and subscribe to this channel and click on the bell button to be notified when the next video comes along.